Good evening. Welcome to Syndrome Differentiation for spleen and stomach, liver, and gallbladder. Under spleen and stomach, we shall talk about spleen qi deficiency, spleen yang deficiency, spleen qi sinking, spleen failing to control blood within vessels, cold dampness obstructing the spleen, damp heat accumulating in the spleen, stomach yin deficiency, food retention, stomach cold, and stomach heat. The spleen and stomach both reside in the middle jiao, or energizer. The spleen governs the transportation and transformation of water, food, and the body fluids. The stomach receives and decomposes food. Spleen qi ascends while stomach qi descends. The spleen and stomach are therefore known as the acquired base and source of qi and blood production. They're externally connected through meridians. The spleen also controls blood with vessels and governs the muscles of the four limbs. It opens into the mouth and its luster shows in the lips. The patterns of the spleen and stomach can be classified into cold, heat, deficiency, and excess. Common signs and symptoms of the spleen conditions include abdominal pain, bloating, diarrhea, edema, lack of energy, and fatigue. Common symptoms of the stomach include stomach ache, poor appetite, vomiting, bulging, and hiccups. Spleen qi deficiency manifests failure of spleen qi to transport and transform. The main contributing factors include an improper diet, overexertion, and chronic conditions consuming spleen qi. Clinical manifestations: poor appetite, gastric or abdominal fullness, and distension, especially after eating food. Loose stools, mental fatigue, lack of qi, reluctance to talk, pallor or a sallow complexion, pale tongue with a white coating, and a moderate weak pulse. Edema or weight loss may also be present. Failure of spleen qi to transport and transform may cause a poor appetite and gastric or abdominal fullness and distension, especially after eating food. Water retention due to spleen qi deficiency may cause loose stools. Failure of the spleen to nourish muscles and the four limbs causes fatigue. Spleen qi deficiency causes lack of qi and reluctance to talk. Water dampness due to spleen deficiency causes pallor and edema. Insufficient production of qi and blood causes weight loss and a sallow complexion. A pale tongue with a white coating and a floating weak pulse are typical signs of spleen qi deficiency. Symptoms due to spleen deficiency may vary greatly. However, it can be identified by qi deficiency symptoms coupled with exclusion of other organs such as the heart and kidneys. Also, this pattern should be distinguished from dampness syndromes, which will be discussed later. The distinctive points of this pattern include qi deficiency symptoms and hypofunction of the stomach, such as a poor appetite, bloating, especially after eating food, diarrhea, weight loss, a lusterless complexion, or facial puffiness. In addition, dampness and phlegm need to be excluded, such as a swollen tongue with a greasy tongue coating and obesity. Spleen yang deficiency manifests failure of spleen yang to warm and transport. It often develops from spleen qi deficiency. The main contributing factors include overingestion of cold or raw food, overuse of cool or cold property medications, and kidney yang deficiency. Clinical manifestations include bloating, poor appetite, dull abdominal pain with a preference for warmth and pressure, cold intolerance, cold limbs, thin loose stools, a pale swollen tongue with a white slippery coating, and a deep, slow, or weak pulse. A general heavy sensation, edema in the limbs, dysuria or profuse white, thin clear leukorrhea may also be present. Failure of spleen yang to transport and transform may cause bloating and a poor appetite. Yang deficiency may produce internal cold retention and qi stagnation, causing abdominal pain with a preference for warmth and pressure. Yang deficiency may cause water dampness retention and subsequent thin loose stools. Failure of spleen yang to warm the body may cause cold intolerance and cold limbs. Internal water dampness may impair the qi transformation of the urinary bladder, leading to dysuria. Water dampness in the body may cause a general heavy sensation. Downward flow of water dampness may cause profuse white, thin, clear leukorrhea. A pale and a swollen tongue with a white slippery coating and a deep, slow, weak pulse are typical signs of internal cold dampness due to yang qi deficiency. This pattern can be identified by spleen qi deficiency symptoms coupled with cold intolerance or cold limbs. However, spleen yang deficiency can cause other accompanying symptoms such as diarrhea, edema, or white, thin, clear leukorrhea. The distinctive points of this pattern include a chronic duration, spleen-related symptoms such as appetite, digestion, and muscle, and yang deficiency symptoms. Also, excessive dampness needs to be excluded. Spleen qi sinking manifests loosened tendons or muscles and prolapsed internal organs due to spleen qi deficiency. Main contributing factors include an improper diet, overexertion, and chronic conditions affecting the spleen. A falling sensation of the epigastrium or abdomen, particularly after eating food. Frequent urges for bowel movements with a falling sensation of the uterus. Persistent diarrhea or dysentery, prolapse, uterine prolapse, turbid urine, dizziness, blurred vision, general heavy sensation, fatigue, low voice, reluctance to talk, pale tongue with a white coating and a weak pulse. Failure of spleen qi to transport and transform may cause inadequate supply to internal organs and subsequent prolapse, such as uterine prolapse or stomach prolapse. Stomach prolapse causes a falling sensation in the stomach, especially after eating food. Sinking of spleen qi causes frequent urges for bowel movements with a falling sensation of the anus, persistent diarrhea, or dysentery. Failure of the spleen to distribute nutrients may affect the urinary bladder, leading to turbid urine. Failure of spleen yang to ascend may cause dizziness and blurred vision. Spleen qi deficiency causes a general heavy sensation, fatigue, low voice, and reluctance to talk. A pale tongue with a white coating and a weak pulse are typical signs of spleen qi weakness. The distinctive points of this pattern include spleen qi deficiency, sinking of organs such as stomach prolapse, rectal prolapse, or uterine prolapse, sinking of qi such as dizziness and blurred vision, and sinking of nutrients such as turbid urine. Sinking of organs is most distinctive for identification. It is worth noting that some symptoms can also be seen in kidney deficiency. This will be discussed later in pattern identification of the kidneys and urinary bladder. Spleen failing to control blood within the vessels. The spleen failing to control blood within the vessels manifests bleeding conditions due to spleen deficiency. The main contributing factors are chronic conditions and overexertion. Clinical manifestations: bloody stools, bloody urine, subcutaneous bruises, bleeding gums, heavy menstruation, uterine bleeding, pale tongue with a white coating and a thready weak pulse, dizziness, mental fatigue, lassitude, reluctance to talk, poor appetite, loose stools, and a lusterless complexion may also be present. Failure of the spleen to control blood within the vessels may cause bloody stools, bloody urine, subcutaneous bruises, and bleeding gums. This may further result in weakness of the Chong and Ren meridians, leading to heavy menstruation or uterine bleeding. Insufficient production of qi and blood may cause dizziness, mental fatigue, lassitude, reluctance to talk, and a lusterless complexion. Spleen deficiency may also cause internal turbid dampness, resulting in a poor appetite and loose stools. A pale tongue with a white coating and a thready weak pulse are typical signs of deficiency. This pattern should be distinguished from other patterns that may cause bleeding. Other than trauma, pathogenic heat and stagnant blood may also contribute to bleeding. Pathogenic heat often causes bright red blood, while stagnant blood causes dark blood and often involves a long duration. The spleen failing to control blood in the vessels often causes pale-colored blood coupled with spleen deficiency symptoms. This pattern can be considered a severe pattern of spleen Qi deficiency. It can be identified on the basis of spleen Qi deficiency with bleeding. Cold dampness obstructing the spleen. Cold dampness obstructing the spleen manifests internal cold dampness affecting spleen yang. The main contributing factors include an improper diet, over-ingestion of cold food, and internal exuberance of dampness. Clinical manifestations: gastric or abdominal distension, oppression and pain, nausea, vomiting, poor appetite, tastelessness, no thirst, loose stools, heavy sensation of the head and body, a dark yellow complexion, pale swollen tongue with a white greasy slippery coating and a soft moderate pulse. Dark gray, yellow face and eyes, edema in the limbs, scanty urine, and profuse leukorrhea may also be present. Internal cold dampness obstructing spleen yang may cause gastric or abdominal distension, oppression and pain with a poor appetite. Failure of stomach qi to descend may cause nausea and vomiting. Cold dampness, which is yin in nature, retention, causes tastelessness and no thirst. Downward flow of dampness causes loose stools. Dampness has the property of heaviness and stickiness, causing a heavy sensation of the head and body. It may impair the circulation of qi and blood, leading to a lusterless complexion. Failure of spleen yang to disperse may cause overflow of bile, leading to dark gray-yellow face and eyes. Cold dampness may cause the failure of yang qi to transform water dampness, resulting in edema in the limbs. Cold dampness may also impair the qi transformation of the urinary bladder, leading to scanty urine. Internal exuberance of cold dampness causes a pale and swollen tongue with a white, greasy, or white slippery coating and a soft, moderate pulse. This pattern should be distinguished from spleen yang deficiency. Both patterns can cause failure of the spleen to transport and transform cold signs and dampness symptoms. However, cold dampness obstructing the spleen is an excess pattern with a short duration and often causes a white greasy or white slippery coating and a soft moderate pulse, while spleen yang deficiency is a deficiency pattern with a long duration and often causes a white slippery tongue coating and a slow deep pulse. The distinctive points of this pattern include a short duration, an absence of spleen qi deficiency symptoms, and obvious cold dampness symptoms. Damp heat accumulating in the spleen manifests internal damp heat affecting the middle jaw. The main contributing factors include over-ingestion of sweet fatty food, excessive consumption of alcohol, and external contraction of damp heat. Gastric or abdominal discomfort, nausea, vomiting, a poor appetite, dark yellow urine, loose stools, heavy sensation in the limbs, bright or orange yellow face, eyes and skin itching, persistent unresolved fever, red tongue with a yellow greasy coating, and a soft, rapid pulse. Damp heat may impair the transportation and transformation of the spleen and affect the descending of stomach qi, thus resulting in gastric or abdominal discomfort, nausea, vomiting, and a poor appetite. Dampness has the property of heaviness and stickiness, causing a heavy sensation of the head and body. Downward flow of damp heat may cause loose stools and scanty, dark yellow urine. Damp heat scorching the liver and gallbladder may cause overflow of bile, resulting in yellow face and eyes in a bright orange color and skin itching. Hidden damp heat may cause persistent unresolved fever. A red tongue with a yellow greasy coating and a soft rapid pulse are typical signs of internal damp heat. Damp heat scorching the liver and gallbladder may cause overflow of bile, resulting in yellow face and eyes in a bright orange color and skin itching. Hidden damp heat may cause persistent unresolved fever. A red tongue with a yellow greasy coating and a soft rapid pulse are typical signs of internal damp heat. This pattern should be distinguished from dampness obstructing the spleen and stomach, external contraction of damp heat, and damp heat in the liver and gallbladder. It is different from cold obstructing the spleen and stomach in heat symptoms. External contraction of damp heat is often seen in summer or autumn with a short duration and obvious exterior syndrome manifestations such as fever, chills, and general pain. Damp heat in the liver and gallbladder causes distending pain and discomfort in the hypochondriac regions. The distinctive points of this pattern are jaundice, fever, and diarrhea, either alone or in combination. In addition, damp heat symptoms such as a yellow greasy tongue coating and spleen stomach symptoms such as a poor appetite and gastric or abdominal fullness and distension are present. Stomach yin deficiency manifests a condition of internal deficient heat due to insufficiency of stomach yin. The main contributing factors include chronic stomach conditions, yin fluid consumption at the later stages of febrile conditions, overingestion of hot spicy food, and emotional disturbance transforming into fire. Clinical manifestations: dull gastric pain, increased appetite, gastric discomfort, retching, belching, dry mouth and throat, constipation, scanty dark yellow urine, dry red tongue, and a thready rapid pulse. Stomach yin deficiency may cause internal deficient heat to affect the descending of stomach qi, thus resulting in a dull gastric pain and increased appetite and gastric discomfort. Deficient heat may disturb the stomach, resulting in ascending of stomach qi and subsequent retching and hiccups. Failure of stomach yin to moisten the throat causes a dry mouth and throat. Failure of stomach yin to moisten the large intestine causes constipation. A dry red tongue and a thready rapid pulse are typical signs of internal heat due to yin deficiency. This pattern should be distinguished from stomach fire. Stomach fire is an excess pattern and causes a foul breath, a yellow tongue coating, and a rough tongue. However, stomach fire may gradually result in stomach yin deficiency with hyperactivity of fire. The distinctive points of this pattern include yin deficiency symptoms with abnormal digestion. In the case of presence of spleen qi deficiency symptoms, the pattern can be identified as spleen yin deficiency. Food retention manifests indigestion of food in the stomach. The main contributing factors include improper diet and constitutional deficiency of the spleen and stomach. Clinical manifestations: gastric distension and pain, loss of appetite, belching, acid reflux, vomiting. The gastric distension and pain can be relieved after vomiting or flatus. A thick, greasy tongue coating and a slippery pulse. Smelly loose stools may also be present. Food retention may impair the descending of stomach qi and result in gastric distension and pain. Retention of undigested food causes loss of appetite. Failure of stomach qi to descend and ascending of turbid qi may cause belching, acid reflux, and vomiting. Vomiting can temporarily downregulate stomach qi and thus alleviate the gastric distension and pain. Downward flow of undigested food may cause flatus and smelly loose stools. Ascending of turbid stomach qi causes a thick, greasy tongue coating. A slippery pulse is indicative of an excess syndrome. This pattern should be distinguished from spleen deficiency. Spleen deficiency is a deficiency pattern and is characterized by deficiency symptoms. A history of food injury is not necessary for spleen deficiency. This pattern can be identified by a history of food injury and exclusion of spleen qi deficiency and stomach fire. Stomach cold results from overingestion of cold food. It manifests a condition of yin-cold retention in the stomach. Clinical manifestations: mild or spasmodic gastric pain that can be aggravated by cold and relieved by warmth, tastelessness, no thirst, a pale tongue with a white slippery coating, and a deep or wiry pulse. Alternatively, mental fatigue, cold intolerance, cold limbs, preference for warmth. The gastric pain can be alleviated after eating food, and watery vomiting may also be present. Stomach cold can be classified into cold attacking the stomach and deficiency and cold of stomach qi. Cold has the property of contraction and can cause qi stagnation, resulting in gastric pain. Cold is seen in nature and can therefore aggravate pain. Yin pathogens do not consume fluids, causing tastelessness and no thirst. Over time, yang qi can be damaged, followed by a transformation into a deficiency pattern. Binding of spleen qi causes mental fatigue. Failure of yang qi to warm the body causes cold intolerance, cold limbs, and preference for warmth. Eating food can activate yang qi and therefore alleviate pain. Failure of stomach qi to warm and transform nutrients, as well as ascending of stomach qi, may cause watery vomiting. A pale tongue with a white slippery pulse is a typical sign of internal yin cold with water retention. A deep pulse is indicative of cold. Water retention causes a wiry pulse. This pattern should be distinguished from the spleen conditions. Stomach cold mainly causes stomach ache, while spleen cold mainly causes diarrhea. In addition, deficiency is much more common in the spleen conditions than in the stomach conditions. Cold attacking the stomach and deficiency and cold in the stomach can be identified by the duration. The former is acute, while the latter is chronic and lingering, involving mild symptoms with deficiency symptoms such as a cold sensation of the stomach with a preference for warmth and a lusterless complexion. Stomach heat manifests exuberance of stomach fire. The main contributing factors include heat attacking the stomach, liver qi stagnation transforming into fire, and overingestion of hot, spicy, fatty food. Clinical manifestations: gastric pain with a burning sensation, acid reflux, fast hunger even with an increased appetite, thirst with a desire to drink cold water, swelling, pain, ulcers or even bleeding gums, foul breath, constipation, dark yellow urine, red tongue with a yellow coating and a slippery, rapid pulse. Internal exuberance of stomach fire may impair the stomach collaterals, causing gastric pain with a burning sensation. Fire transformed from liver qi stagnation may affect the stomach, leading to ascending of stomach fire and subsequent gastric discomfort and acid reflux. Hyperactive stomach fire causes an increased appetite but fast hunger. Heat-consuming fluids may cause thirst with a desire to drink cold water. Since the stomach meridian passes through the gums, ascending of stomach fire may cause swelling, pain, ulceration, and even bleeding gums. Ascending of turbid stomach qi causes a foul breath. Heat-consuming fluids in the intestines causes constipation and scanty dark yellow urine. A red tongue with a yellow coating and a slippery rapid pulse are typical signs of exuberant heat. This pattern should be distinguished from damp heat due to spleen deficiency. Generally, the stomach can be identified by gastric pain, vomiting, and acid reflux, while the spleen can be identified by abdominal distension and diarrhea. This pattern can be concluded by a heat syndrome plus stomach pain or ascending of stomach qi. However, it is worth noting that mouth or gum ulcerations can also be known as ascending of stomach fire, and acid reflux can also be known as liver fire affecting the stomach. Here's a table for syndrome differentiation of spleen and stomach patterns. Spleen qi deficiency is spleen qi deficiency symptoms plus spleen-related symptoms. Spleen-yang deficiency, you have spleen-related symptoms plus yang deficiency symptoms plus exclusion of excessive dampness. Spleen-qi sinking, you have spleen-qi deficiency plus sinking symptoms. Spleen failing to control blood in blood vessels, spleen-qi deficiency plus bleeding. Cold dampness obstructing the spleen, short duration plus absence of spleen-qi deficiency plus obvious cold dampness symptoms. Damp heat accumulating in the spleen, we have jaundice, yellow face, eyes, skin, plus fever or diarrhea. Stomach yin deficiency symptoms plus abnormal digestion. Food retention, history of food injury plus exclusion of spleen-qi deficiency and stomach fire. Stomach cold, be clear about cold attacking the stomach and deficiency and cold of stomach qi. Stomach heat syndrome plus stomach ache or ascending of stomach qi. Liver and gallbladder, we discussed the following patterns: liver qi stagnation, ascending of liver fire, liver blood deficiency, liver yin deficiency, hyperactivity of liver yang, internal stirring of liver wind, liver yang transforming into wind, extreme heat generating wind, yin deficiency stirring wind, blood deficiency generating wind. Cold retention in the liver meridian, damp heat in the liver and gallbladder qi stagnation with phlegm retention. The liver resides in the right side hypochondriac area, and the gallbladder is attached to the liver. They are externally connected through meridians. The liver maintains free flow of qi, that is, it regulates qi activity, emotions, bile secretion and discharge, digestion and absorption of the spleen and stomach, as well as the transportation and distribution of qi, blood, and body fluids. In addition, it helps to regulate ovulation, menstruation, and semen. Another main function of the liver is to store blood and regulate the blood volume. The liver opens into the eyes, its tissue shows in tendons, and its luster manifests in nails. The physiological functions of the gallbladder are to store and discharge bile and help to digest food. The gallbladder is also associated with emotions. Its functions are regulated and controlled by the liver. A normal function of the liver in maintaining the free flow of qi can guarantee normal bile storage and discharge, thus maintaining normal physiological functions of the body. The main pathologies of the liver manifest either as a dysfunction of the liver in maintaining free flow of qi or as a disorder of the liver in storing the blood. Common signs and symptoms of the liver conditions include a distending or wandering pain in the chest or hypochondriac area, restlessness, irritability, dizziness, headache with a sense of distension, tremor of the limbs, convulsions of the hands and feet, blurred vision, irregular menstruation, and distending pain of the testes. The patterns of the liver conditions can be classified into cold, heat, deficiency, and excess. The main pathologies of the gallbladder manifest as either an abnormal function of the gallbladder in storing and discharging the bile or emotional disturbance. Common signs and symptoms of the gallbladder conditions include a bitter taste, tendency to panic, insomnia, and jaundice. Liver qi stagnation manifests an abnormal function of the liver in maintaining the free flow of qi. The main contributing factors include mental irritation, depression, and chronic conditions of other organs. This pattern is characterized by qi stagnation along with varying symptoms in different body parts where the qi stagnation stays. Clinical manifestations: depression, restlessness, irritability, frequent sighing, distension, tightness or wandering pain in the chest or hypochondriac regions, a foreign body sensation in the throat, also known as plum stone qi or globus hystericus, enlarged thyroid, abdominal masses, breast distension or masses, irregular menstruation, dysmenorrhea, amenorrhea, and a wiry pulse. The liver is closely associated with emotions. Mental irritation or emotional disturbance may cause liver qi stagnation, resulting in depression, restlessness, irritability, and frequent sighing. Since the liver meridian passes through the hypochondriac regions and lower or lateral abdomen, liver qi stagnation may cause distension, tightness or wandering pain in the chest or hypochondriac regions. Over time, qi stagnation may produce phlegm to ascend with qi, leading to foreign body sensation and enlarged thyroid or abdominal masses. Qi stagnation may also cause blood stasis, affecting the Chong and Ren meridians and thus resulting in breast distension and masses, irregular menstruation, dysmenorrhea or amenorrhea. A wiry pulse is indicative of a liver condition. Persistent liver qi stagnation may transform into fire, developing ascending of liver fire. Liver qi stagnation may also affect the spleen, developing liver qi affecting the spleen. Additionally, it may further result in blood stasis. This pattern should be distinguished from ascending of liver fire. Liver qi stagnation is marked by qi depression, qi stagnation, and emotional fluctuations, while ascending of liver fire is mainly marked by fire heat symptoms. The distinctive points of this pattern are mental irritation, emotional depression, and dysfunction of the liver in maintaining the free flow of qi. The severity of this pattern is closely linked to emotions. Ascending of liver fire manifests the fire transformed from liver qi stagnation, ascending along the pathway of the liver meridian. The main contributing factors include persistent liver qi stagnation, over-ingestion of hot, warm food, and internal buildup of damp heat. Clinical manifestations: dizziness, headache with a sense of distension, tinnitus, a red face, redness, swelling, and pain of the eyes. Restlessness, irritability, insomnia or dream-disturbed sleep, a dry mouth with a bitter taste. Constipation, scanty dark yellow urine, a red tongue with a yellow coating, and a wiry rapid pulse. Alternatively, a burning pain in the hypochondriac regions, hematemesis, heavy menstruation, or an earlier menstrual period may also be present. Ascending liver fire may disturb the head, leading to dizziness and headache with a sense of distension. Since the liver opens into the eyes, ascending of liver fire along the meridian may cause redness, swelling, and pain of the eyes. Since the gallbladder is attached to the liver and the gallbladder meridian enters the ears, liver fire may affect the gallbladder and result in tinnitus. Internal disturbance of liver fire may cause restlessness, irritability, insomnia, or dream-disturbed sleep. Liver fire affecting the liver collaterals may cause a burning pain in the hypochondriac regions. Fire heat consuming fluids may cause a dry mouth with a bitter taste, constipation, and scanty dark yellow urine. Liver fire may accelerate the flow of blood, further resulting in hematemesis, heavy menstruation, and an earlier menstrual period. A red tongue with a yellow coating and a wiry rapid pulse are typical signs of an excess liver syndrome. Ascending of liver fire develops from liver qi stagnation. Left uncontrolled, this pattern may further result in hyperactivity of liver yang, transforming into yin. This pattern should be distinguished from hyperactivity of liver yang. Both patterns show a red face and eyes, restlessness, and irritability. However, hyperactivity of liver yang also causes soreness and weakness of the low back and knee joints due to liver yin deficiency. The distinctive point of this pattern is a history of liver qi stagnation with obvious symptoms caused by internal heat transforming into fire. Liver blood deficiency manifests failure of the liver in regulating blood and subsequent malnourishment of the relevant Zangfu organs. The main contributing factors include insufficient production of blood, loss of blood, and chronic conditions consuming liver blood. It generally involves liver-related symptoms of a systemic blood deficiency. Clinical manifestations: vertigo, tinnitus, dry eyes, blurred vision, poor vision, or night blindness. Pale, lusterless, or sallow complexion, numbness or tremor of the hands and feet, muscle spasm or twitching, dry nails, scanty menstruation in a pale color, amenorrhea, pale lips, a pale tongue with a thin coating, and a thready pulse. Failure of liver blood to nourish the mind may cause vertigo and tinnitus. Since the liver opens into the eyes, Liver blood deficiency causes dry eyes, blurred vision, poor vision, or night blindness. Failure of liver blood to ascend and nourish the head and face may cause a pale lusterless or sallow complexion and a pale tongue and lips. Since the tissue of the liver shows in tendons and its luster manifests in nails, liver blood deficiency causes numbness or tremor of the hands and feet, muscle spasm or twitching, dry nails, and a thready pulse. Failure of liver blood to nourish the chong and ren may cause scanty menstruation in a pale color or amenorrhea. Left untreated, liver blood deficiency may further develop into blood deficiency generating wind. This pattern should be distinguished from heart blood deficiency. Both patterns have blood deficiency symptoms. However, they can be identified by heart or liver related symptoms. Additionally, this pattern needs to be distinguished from liver yin deficiency. Liver blood deficiency is mainly marked by blood deficiency, while liver yin deficiency is mainly marked by deficient heat. The distinctive points of this pattern include blood deficiency symptoms and liver-related symptoms. Liver yin deficiency manifests deficient heat due to insufficiency of liver yin fluids. The main contributing factors include liver qi stagnation transforming into fire and damage to yin fluids at the later stages of liver conditions or febrile diseases. Clinical manifestations: vertigo, tinnitus, dry, painful eyes, pain in the hypochondriac regions, hot flashes, feverish sensations on the palms, soles and chest, tidal fever, night sweats, dry mouth, twitching of the hands and feet, a dry red tongue, and a wiry, thready, rapid pulse. Failure of liver yin to nourish the head and eyes may cause vertigo and tinnitus. Since the liver opens into the eyes, liver yin deficiency causes dry, painful eyes. Failure of liver yin to nourish the liver meridian may cause pain in the hypochondriac regions. Yin deficiency may produce internal heat and result in hot flashes, feverish sensations on the palms, soles, and chest, tidal fever, night sweats, a dry mouth, a dry red tongue, and a wiry, thready pulse. Failure of liver yin to nourish tendons or muscles may cause twitching of the hands and feet. It is worth noting that liver yin deficiency may affect the kidneys, leading to yin deficiency of the liver and kidneys and subsequent hyperactivity of liver yang. This pattern should be distinguished from ascending of liver fire. Both patterns have heat symptoms. However, this pattern manifests deficient heat in the liver, while ascending of liver fire manifests excessive heat in the liver. The distinctive points of this pattern include general yin deficiency symptoms and liver-related symptoms. Hyperactivity of liver yang manifests failure of liver yin to control liver yang. It is characterized by liver yin deficiency and hyperactivity of liver yang. The main contributing factors include liver qi transforming into fire to consume liver yin and yin deficiency of the liver and kidneys. Clinical manifestations: vertigo, tinnitus, headache with a sense of distension, a top-heavy feeling, red face and eyes, restlessness, irritability, insomnia, or dream-disturbed sleep. Soreness and weakness of the low back and knee joints, feverish sensations of the palms, soles, and chest, hot flashes, a red tongue, and a wiry, powerful, or wiry, thready, rapid pulse. Hyperactive yang due to yin deficiency of the liver and kidneys may cause vertigo, tinnitus, headache with a sense of distension, a top-heavy feeling, and red face and eyes. Liver qi stagnation transforming into fire may cause restlessness, irritability, insomnia, or dream-disturbed sleep. Failure of liver yin to nourish tendons or muscles may cause soreness and weakness of the low back and knee joints. Internal deficient heat due to yin deficiency causes feverish sensations in the palms, soles, and chest, hot flashes, a red tongue, and a wiry, powerful, or wiry, thready, rapid pulse. This pattern should be distinguished from ascending of liver fire and liver yin deficiency. The distinctive points of this pattern include manifestations due to yin deficiency of the liver and kidneys and symptoms due to hyperactivity of liver yang. Internal stirring of liver wind manifests a set of clinical symptoms including vertigo, tremor, and convulsions. It is mainly caused by failure of yin fluids and essence, blood of the liver and kidneys to nourish tendons and constrain yang. Clinically, this pattern can be subcategorized into liver yang transforming into wind, extreme heat generating wind, yin deficiency stirring wind, and blood deficiency generating wind. Liver yang transforming into wind. This develops from hyperactivity of liver yang. It is mainly caused by failure of yin fluid, deficiency of the liver and kidneys to constrain yang. Clinical manifestations: vertigo, headache, top-heavy feeling, unstable walking, a red tongue with a thin or greasy coating, and a wiry, powerful pulse. Alternatively, neck rigidity, tremor of the limbs, numbness of the hands and feet, slurred speech, a deviated tongue, sudden collapse, unconsciousness. Deviated mouth and eyes, hemiplegia, tongue stiffness, and phlegm sounds in the throat may also be present. This pattern often follows hyperactivity of liver yang. Hyperactive liver yang disturbing the mind may cause vertigo, headache, a top-heavy feeling, and unstable walking. Ascending of liver wind carrying disordered qi and blood may cause neck rigidity, tremor of the limbs, and numbness of the hands and feet. Ascending of liver wind carrying turbid phlegm may cause slurred speech with a deviated tongue. Liver wind mixed with turbid phlegm may disturb the mind, leading to sudden collapse, unconsciousness, tongue stiffness, and phlegm sounds in the throat. Wind phlegm obstructing the meridians may cause deviation of the mouth and eyes and hemiplegia. A red tongue and a wiry, powerful pulse are typical signs of hyperactive yang transforming into wind. With pre-existing hyperactivity of the liver yang, presence of aggravated headache and dizziness, tremor of the hands and feet, and numbness of the limbs can be identified as liver yang transforming into wind. These symptoms are warning signs of a stroke. Stroke-related symptoms including sudden collapse, unconsciousness, tongue stiffness, hemiplegia, and phlegm sounds in the throat can be life-threatening. This pattern should be distinguished from hyperactivity of liver yang. Both patterns have vertigo and headache. However, this pattern is more severe than hyperactivity of liver yang, coupled with the presence of tremor or numbness of the limbs. In severe cases of this pattern, sudden collapse and hemiplegia may also occur. The distinctive notes of this pattern include a history of hyperactivity of liver yang and presence of wind stirring or abnormal mental activities. Extreme heat generating wind manifests stirring of liver wind due to exuberant heat consuming yin fluid. It is often caused by a high-grade fever. Clinical manifestations: high-grade fever, delirium, manic restlessness, uncontrollable jerking movements of the arms and legs, neck rigidity, opisthotonus, trismus, a staring spell, a red tongue with a yellow coating, and a wiry, rapid pulse. Exuberant heat causes a high-grade fever. Heat disturbing the mind may cause manic restlessness. Heat consuming body fluids may cause malnourishment of the tendons and muscles, leading to tremor of the hands and feet, neck rigidity, opisthotonus, trismus, and a staring spell. Heat misting the mind may cause coma and delirium. A red tongue with a yellow coating and a wiry rapid pulse are typical signs of exuberant heat. This pattern should be distinguished from liver yang transforming into wind. Both patterns have wind-stirring symptoms. However, this pattern is marked by a high-grade fever with wind, while liver yang transforming into wind is linked to a history of liver yin deficiency and hyperactivity of liver yang. This pattern is distinctively marked by high fever and wind stirring. Yin deficiency stirring wind manifests failure of yin fluid to nourish tendons and muscles. It is often caused by severe deficiency of yin fluid and is commonly seen in the later stages of externally contracted conditions or internally damaged miscellaneous diseases. Clinical manifestations: twitching of the hands, feet, and muscles, tidal fever in the afternoon, feverish sensations on the palms, soles, and chest, night sweats, dry mouth and throat, weight loss, a red tongue with a scanty coating and a wiry rapid pulse. Severe consumption of yin fluid in the later stages of febrile or miscellaneous diseases may cause twitching of the hands, feet, and muscles. Yin deficiency may produce internal heat, causing tidal fever in the afternoon, feverish sensations on the palms, soles, and chest, a dry mouth and throat, weight loss, a red tongue with a scanty coating, and a wiry rapid pulse. This pattern should be distinguished from liver yang transforming into wind and extreme heat generating wind. All three patterns have wind stirring symptoms. However, liver yang transforming into wind is marked by hyperactive yang due to yin deficiency. Extreme heat generating wind is marked by high fever with wind stirring, and yin deficiency stirring wind is marked by yin deficiency symptoms with twitching of the hands and feet. This pattern involves yin deficiency and wind stirring. Blood deficiency generating wind manifests failure of blood to nourish the tendons and muscles. It is often caused by heavy bleeding or chronic conditions. Clinical manifestations: twitching of the hands, feet, and muscles, numbness with impaired movement of the limbs, vertigo, tinnitus, dry eyes with blurred vision. Lusterless or sallow complexion, dry nails, a pale tongue, and a wiry thready pulse. Since the liver stores blood and opens into the eyes, its tissue shows in the tendons and its luster manifests in the nails. Liver blood deficiency may cause twitching of the hands, feet, and muscles, numbness with impaired movement of the limbs, and dry nails. Failure of liver blood to ascend to nourish the brain may cause vertigo, tinnitus, dry eyes with blurred vision, and a lusterless or sallow complexion. A pale tongue and a wiry thready pulse are typical signs of liver blood deficiency. This pattern should be distinguished from yin deficiency stirring wind. Both patterns have wind stirring symptoms. However, yin deficiency stirring wind is marked by tidal fever and night sweats, while blood deficiency generating wind is marked by a lusterless complexion and a pale tongue. The distinctive points of this pattern include deficient wind stirring and blood deficiency symptoms. Cold retention in the liver meridian manifests chi stagnation and blood stasis within the liver meridian. It is often caused by contraction of cold. Clinical manifestations: lower or lateral abdominal pain with a cold sensation. The pain may radiate to the testis or scrotum, coupled with the falling sensation and tenderness. The pain may also radiate to the thigh. The pain can be aggravated by cold and relieved by warmth. Pale tongue with a white or dark coating and a deep wiry pulse. Cold intolerance, cold limbs, and pallor may also be present. Since the liver meridian passes around the genitalia and lower abdomen, cold retention in the liver meridian may cause cold pain in the lower abdomen, testis, and scrotum with a falling sensation or a pain radiating to the thigh. Cold has the property of contraction and can affect the circulation of qi and blood, leading to tenderness and pain that can be aggravated by cold and alleviated by warmth. Cold can obstruct yang qi and thus cause cold intolerance, cold limbs, pallor, and a pale tongue with a white coating. A deep wiry pulse is indicative of a liver condition. This pattern should be distinguished from cold hernia, also known as the small intestine herniated into the scrotum. Cold hernia is marked by pain alone without cold symptoms. This pattern is distinctively marked by pain in the lower abdomen and testes with a falling sensation, as well as cold symptoms such as cold limbs, and the pain can be aggravated by cold. Damp heat in the liver and gallbladder manifests internal accumulation of damp heat in the liver and gallbladder. The main contributing factors include external contraction of damp heat, internal damp heat due to spleen deficiency, and overingestion of sweet fatty food. Clinical manifestations: burning or distending pain in the hypochondriac regions, masses in the hypochondrium region with a tenderness upon palpation, yellow eyes, yellow urine, and yellow body skin. This is bright orange-like yellow. Fever, a bitter taste, poor appetite, nausea, vomiting, bloating, constipation or diarrhea, a red tongue with a yellow greasy coating, and a wiry rapid or wiry slippery pulse. Internal buildup of damp heat may affect chi activities, causing burning or distending pain in hypochondriac regions or masses with tenderness upon palpation. Damp heat may impair the function of the liver in maintaining the free flow of chi, leading to overflow of bile and subsequently a bitter taste, yellow eyes, and yellow urine. A bright orange-like yellow indicates yang jaundice. Internal damp heat may affect the descending of stomach chi, leading to nausea, vomiting, bloating, and constipation or diarrhea. A red tongue with a yellow greasy coating and a wiry rapid or wiry slippery pulse are typical signs of damp heat in the liver and gallbladder. This pattern should be distinguished from damp heat in the spleen and stomach. Both patterns have internal damp heat. However, other than jaundice, damp heat in the spleen and stomach causes a poor appetite, nausea, vomiting, gastric fullness, and a greasy tongue coating, while damp heat in the liver and gallbladder mainly causes jaundice and pain in the hypochondriac regions. This pattern is distinctively marked by damp heat symptoms, jaundice, and pain in the hypochondriac regions. Gallbladder chi stagnation with phlegm retention manifests internal phlegm heat due to dysfunction of the liver and gallbladder in maintaining the free flow of chi. It is mainly caused by emotional disturbance and resultant phlegm dampness. Clinical manifestations: panic, insomnia, restlessness, timidity, a bitter taste, nausea, chest tightness, distension in the hypochondriac regions, dizziness, blurred vision, tinnitus, a yellow greasy tongue coating, and a wiry slippery pulse. Chi stagnation may produce phlegm, dampness, and heat to affect gallbladder chi, leading to panic, insomnia, restlessness, and timidity. Phlegm heat may cause a bitter taste, nausea, chest tightness, and distension in the hypochondriac regions. Ascending of phlegm heat may cause dizziness, blurred vision, and tinnitus. A yellow greasy tongue coating and a wiry slippery pulse are typical signs of internal phlegm heat. This pattern should be distinguished from phlegm fire disturbing the heart, which is marked by restlessness, abnormal mental activities, incoherent speech, and mania. This pattern is distinctively marked by panic, insomnia, and timidity, coupled with chest tightness, nausea, and a yellow greasy tongue coating. Now let's tabulate the syndromes for both liver and gallbladder. Liver chi stagnation means chi depression, chi stagnation, emotional fluctuations. Ascending of liver fire. There's history of liver chi stagnation plus heat symptoms. Liver yin deficiency symptoms plus liver-related symptoms. Hyperactivity of liver yang, yin deficiency symptoms plus hyperactive yang symptoms. Liver yang transforming into wind, history of hyperactivity of liver yang plus wind stirring or abnormal mental activities. Extreme heat generating wind, we have high-grade fever plus wind stirring. Yin deficiency generating wind, yin deficiency symptoms plus wind stirring. Blood deficiency generating wind, blood deficiency symptoms plus wind stirring. cold retention in liver meridian, pain with falling sensation in the lower abdomen and testes, plus cold intolerance, cold limbs, and cold aggravated pain. Damp heat in the liver and gallbladder, damp heat symptoms, plus jaundice or pain in hypochondriac regions, and gallbladder stagnation with phlegm retention. There's panic, insomnia, timidity, plus phlegm heat symptoms like chest tightness, nausea, yellow greasy tongue coating. Thank you very much for listening.